Okay. Hi, Dr. Lofton. This is Brandy doing my physical assessment for your physical assessment class. Hi, good morning. My name is Brandy. I'm a registered nurse in an advanced program going to be doing your assessment today. How are you today?
I'm doing good.
Great. Can you tell me your name?
John Smith,
And your date of birth, sir?
7/7/1980.
Okay. And can you tell me what day is today?
Today is Wednesday, the 23rd of April, 2014.
Excellent. And can you tell me where you're at, sir?
I am in Georgia at Central Georgia Technical College.
Okay. Excellent. Thank you so much. My patient is alert and oriented ×4. My general survey of the patient says that he is appropriately height, weight, good hygiene, no distress, appropriate reactions for him, good affect. Okay, so sir, before we get started on your physical assessment, I want to ask you a couple of questions about your history. First of all, what are you here for today? What brings you in today?
I'm here just for an annual physical.
Okay, so you don't have any complaints today, no illness?
No complaints, no illnesses.
Okay, excellent. So just for an annual physical. Okay, do you take any medications?
No.
Are you allergic to any medications?
No.
Okay, are you allergic to any food?
No.
Okay, excellent. And what is it that you do for a living?
I am an ultrasound tech.
Okay, you're an ultrasound tech. Okay, excellent. Okay, wonderful. Can you tell me a little bit about any childhood illnesses that you may have?
Only illness I had was chickenpox.
Chickenpox and nothing?
That was it.
Nothing outstanding? Okay. Do you have any adult illnesses?
No.
No, have you ever been hospitalized?
No.
Okay, do you have any high blood pressure,
No.
diabetes?
No.
No, any health problems?
No.
No? Okay, so no adult illnesses. Have you ever had surgery before?
Vasectomy, that's it.
A vasectomy? Okay, and what year was that done in?
3 years ago, so 2011.
3 years ago, in 2011. Okay, so that's it for surgical histories. Okay. Do you ever have any feelings of depression or that you might want to hurt yourself?
No.
No feelings of depression. Do you have leisure activities that you enjoy doing?
Yes, playing sports, soccer, intramurals, running, reading.
Running, sports, soccer. It sounds like you stay busy.
Try to.
Okay, and you get a lot of pleasure from those activities?
Oh, yeah.
Good. Excellent. And you said you had a vasectomy. Are you married?
Yes, I am.
Okay, and how long have you been married for?
7 years.
Okay. Do you have kids?
I have 1 6-year-old.
1 6-year-old. Okay, so how many sexual partners do you have currently?
1.
Just the one?
Mhm.
Okay. Have you ever had a sexually transmitted infection?
No.
No sexually transmitted infections? Okay, that sounds good. Sorry. Okay, so moving on, I'm obviously going to not do the GYN assessment because he doesn't need that. So I'm going to ask you just a few questions about your family history, okay?
Okay.
Do you have, your parents are living?
Yes.
And are your grandparents living?
I have 1 living on my mom's side.
On your mom's side. Okay, on your paternal side, on your dad's side, how did those grandparents die?
My grandfather died of lung cancer, and my grandma died in her sleep.
Okay, and how old were they when that happened?
He was 65 and she was 55.
Okay, excellent. Okay, was he a smoker?
Yes, since 15.
Since 15. Do you smoke cigarettes?
No.
Do you chewing tobacco of any
No.
kind? All right, excellent. Okay, so what about on your mother's side?
My grandmother's alive.
Your grandmother's alive. And do you have any idea about her health status?
No.
No ideas about her health
Nope.
status. And any ideas about your grandfather?
Don't know, never met him.
Okay, so we won't worry about that. Okay, now I'm going to say a bunch of disease processes. And what I want you to tell me is if anyone in your family, whether your grandfather, mother, father, brother, sister, any of those people have any of these health problems. Or
Okay.
yourself if you have them. Okay?
Okay.
Okay, does anybody have any history of seizure or headache?
No.
No seizures, no headaches, no migraines? Does anybody have diabetes?
Yes, my dad.
Your dad has diabetes?
Correct.
Okay. And what age was he when he was diagnosed?
51.
Does anyone have hypertension?
He does.
Your dad has hypertension.
Mhm.
Okay. And what age was he? Do you know? Adult?
About the same age.
About the same age. Okay. So that's a positive diabetes and hypertension. Anybody with coronary artery disease?
No.
Anybody had a heart attack?
No.
No. Okay. Is there any breathing disorders like asthma,
Nope.
bronchitis, emphysema? No? Okay. You said you yourself don't smoke.
Correct.
Okay. What about any Digestive problems in your family. Is there any colon cancer,
No,
prostate cancer,
no,
ovarian or uterine cancers
no,
on the female side? Okay, excellent. Family history wise, let's see. Okay, does anybody have any kidney disease in the family?
no.
Okay, are there any other diseases that you know of that anybody has in your family?
Other than mom, depression,
Your mom has depression. Does
Diagnosed.
anybody else
and my
diagnose depression?
sister also.
Okay, so there's two with the depression, but you said you yourself don't have any symptoms of depression?
Correct, none.
Okay, and just the two with the depression.
Correct.
And are they on medications for those?
Yes, they are.
Okay, excellent. Okay, well, okay, that's gonna do good for our family history. And now I'm gonna say just an absolute ton of diseases and stuff, and I want to know if you have those, okay?
Okay.
Okay, do you have any seizures?
No,
Sensitivity to light?
no,
Photophobia?
no,
No. Any headaches, migraine or otherwise?
no,
No? Any hearing difficulties?
no,
No? Any history of ear infections?
no,
Okay, any cancers that you're aware of?
nope,
Okay, high blood pressure?
nope,
Coronary artery disease?
Nope.
Swelling in your feet?
no,
Do you have diabetes that you're aware of?
no,
No? Okay. Any breathing difficulties?
no,
You ever get short breath?
nope,
No? Okay, any stomach problems, anything that you can't digest?
nope.
No food sensitivities? Okay, what's your regular bowel pattern?
Once a day.
Once a day, and that's just a regular form stool?
Yes.
Okay, do you ever have black, bloody, or tarry stools?
No.
No, okay, no. Okay. And what about urine? Do you have any difficulty starting to pee or stopping peeing?
Nope. No problem.
Do you get up at night to pee?
No.
No. Okay, and how is the force of your urine? Do you sometimes start going pee and then feel like you can't get it out, or
No. Not
it
at all.
dribbles? No, okay. Those are signs of prostate problems, and I was just curious if you had any of those. Okay, do you have any, so you don't have any swelling in your feet, do you have any heat or cold intolerances?
No.
No? Okay, any endocrine or thyroid disorders that you're aware of?
Nope.
Okay, you look good. Okay, so now, sir, if, that's our interview. If anything else comes up that we can add a few extra things. If you think of anything else that we need to discuss, let me know as we're doing your exam. Okay? I'm gonna go ahead and wash my hands with some little hand sanitizer here, and I'm gonna take your vital signs. Okay?
Okay.
Camera's still on. 16. Okay. Okay. Let's get this cup on you. Okay, just relax right here. Can you uncross your legs for me? Okay, 126/76, that's certainly within normal. Okay. Okay, I'm just gonna check your pulse. The pulse is 70, respiratory rate is 14, pulse is strong and equal. While I'm here, I'm gonna go ahead and check, I'm just gonna check your hands here and check the cap refill. half refill is less than 3 seconds. I'm just gonna check your arms here for any edema or swelling. Okay, there's no edema and swelling in your arms. I'm gonna check your scalp to see, do you have any itching or dryness, irritation?
No.
No? Okay. Okay, that looks good. And can you just look up for me, please, sir? Checking the sclera are nice and white and conjunctiva, mucous membranes are pink. Do you have any sinus pressure?
No.
Front and maxillary sinus? Okay. Okay, so sir, I'm gonna go ahead and test your cranial nerves, so we're gonna start with that. Can you do me a favor and close your eyes? Okay, I'm gonna block off one of your nostrils, and then I'm gonna put a smell under there. I want you to identify what the smell is. Okay?
Okay.
Okay, this is cranial nerve number 1.
Vanilla.
Good. Okay, keep your eyes closed for me. Okay, I'm gonna do the other side now.
So,
Okay, and center. Thank you. Okay, cranial nerve 1. You can open your eyes now. Thank you. Okay, I'm gonna check cranial nerve number 2 now, peripheral vision. Sir, can you just tell me when you see my fingers come into your vision?
now. 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 Now.
Okay, excellent. I'm gonna check cranial nerve 2 and 3. The pupillary response, I have to turn the lights off really quick. Oh my goodness. Okay. Sir, can you look over my shoulder, please? Okay. Pupils are equal and reactive. Pupils are equal and reactive. I'm going to check cranial nerve 3, 4, and 6. Sir, without moving just moving your eyes, can you follow my finger, please? Okay. 3, 4, and 6 are intact. Excuse me. I'm going to check cranial nerve number 5. Sir, can you please close your eyes and just let me know when you feel me touching on your face?
No. 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 No.
Okay, thank you. I'm just going to put my hands here. Can you make a chewing for me? Okay, cranial nerve 5. Okay, excellent, thank you. Excuse me. I'm going to check cranial nerve number 7. Now, can you make your eyebrows, lift your eyebrows up? Can you smile? And puff your cheeks. Excellent. Cranial nerve number 7, intact. Okay, I'm going to check 9 and 10. Can you open your mouth, please, sir, and say Okay, the palate rises, intact. Okay, sir. Just going to press on your shoulders here. I want you to resist me, okay?
Okay.
This is cranial nerve number 11, spinal accessory. Okay, and I'm going to press on the side of your face. Resist me as well. Okay, excellent. And can you resist this side too? Okay, thank you. Cranial nerve number 11 is intact. To check cranial nerve number 12, can you please stick out your tongue and move it side to side? Okay, excellent. Thank you very much. Okay, I'm going to check cranial nerve number 8 by doing the whisper test. So I'm going to block one of your ears, whisper a number. Can you tell me what it is, please? Okay.
8.
Let me do the other side.
14.
Okay, excellent. So that's intact as well. I'm going to look into your ears. And please let me know if this hurts. Any pain?
No.
Excellent. Okay, ears are normal? Okay. All right, so we checked your ears and hearing. We have no sinus pressure. All right, you can go go ahead and close your eyes for just a second here. I'm gonna flash a light into your nose.
We don't need to get blinded.
Okay, and sir, can you open your mouth for me, please?
You can just say, ah.
Excellent. Can you, yeah, lift your tongue there? Thank you. Okay. Okay, mucous membranes are pink, everything is intact. Do you remember when your last dental exam was?
It was 4 months ago.
Okay, excellent. So you're current on that. That's great. Good, keeping dental health up. Okay, I'm gonna just check your lymph nodes now. Let me know if there's any pain, tenderness, swelling. I'll find the swelling. You tell me about the pain and the tenderness, okay?
Okay.
Clavicular. Okay, sir, and can you go up like this with your arm for me and just make a stop sign? I'm gonna undo your gown for just a second. Checking the central, axillary, lateral, axillary lymph node, and the epitrope lymph node. Okay, great. And then can you do the same thing on this side, please? Okay, great. Thank you so much, sir. Okay. Okay. Okay, I'm gonna come around behind you. I just wanna check your thyroid. So when I tell you to, can you please pick that up and take a drink?
Okay.
Okay, sir, go ahead and pick that up and have a little swallow. Okay, just a second. Okay, go ahead and swallow. Okay, excellent. Okay, thank you. While I'm back here, I'm gonna go ahead and palpate the spine. Any pain or tenderness?
Nope.
Okay, and you said you didn't have any pain. Do you have any back pain at all?
No.
Ever?
Nope.
No? Okay, that looks good. As I'm back here, I'm gonna go ahead and, percuss the lungs. Okay. Can you just tell me if this hurts here?
Nope.
Nothing here? Any on this side?
Nope.
Okay, excellent. Okay, so there's no flank tenderness. Sir, I'm gonna listen to your lungs as I'm back here. When you feel my stethoscope touch your back, can you just take a deep breath for me in with your mouth?
Okay.
Okay. Okay, excellent. Okay, that sounds great. Okay, I'm gonna come around the front. I noticed you have a lot of moles on your back. Do you know the signs of skin cancer?
No.
Okay, I'm just gonna give you a quick little memory tool to do it. Things that we're looking for to change are A, B, C, D, E. A stands for asymmetrical. Okay, so we want any mole that you have to be able to be a line drawn in half and then to fold it over, like if you could imaginary do that. Anything that's not asymmetrical could be something that needs to be checked out. Okay, so anything that's not symmetrical, we want to have checked out. That's the A. The B is for the border, and that means usually on a mole, most of your moles in the back are circular and round. They're even borders, okay? Anything that looks notched or scalloped, that could be a problem. We would have that checked out, okay? Color, yours are mostly brown in the back, but if you have a color that gets partly brown and then gets changed in the middle, that's a color change, and that needs to be investigated. Or if you had a brown mole and it turns red, blue, any other color, okay, that would need to be looked at. The D stands for diameter. So if your mole is bigger than the head of a pencil eraser, that warrants a check. Okay, so come in and have that one checked. And then the E stands for evolving. So if there's a change in your mole, okay, like if it changes color, like it turned brown and then it turned red, or if it starts to itch or it starts to bleed, okay, anything that changes in your moles warrants an observation. Do you have those checked checked out on a regular basis?
Every year, annual.
An annual mold check. Okay, that's excellent. Well, I'll be doing a full skin assessment on you, and as we go along, if I see anything that needs to be checked out, we'll talk about it, okay?
Okay.
But just let you know, A, B, C, D, E, okay? Can you kind of scoot just a little bit to the, okay, excellent. So I'm gonna go ahead and kind of take you down a little bit here. If you can lean forward for me, please. I want you to take a deep breath, and then let it out when I say. Okay. Okay, excellent. Okay, thank you. That's just starting off our cardiac assessment here. Can you go ahead and swing on over? Like that. So I'm gonna. Okay, with the head of bed at approximately 30 degrees, I'll look for JVD. Sir, can you go ahead and look that way? Just relax your head. Okay, and then look over this way. Okay, excellent, that's great, thank you. So no JVD noted, head of bed at 30 degrees. I'm gonna go ahead and look. Go ahead and feel the carotid. Okay. The carotids are strong and equal. I'm going to listen for any bruits. Okay, carotids are strong and equal with no bruit. Sir, I'm going to go ahead and pull your gown down a little bit. I think I'm talking about them. And I'm going to begin carry on with the cardiac assessment. So on the right side, second intercostal space, the aortic, left side, pulmonic, tricuspid, mitral valve, okay, and I'm also going to feel for the PMI. Okay, with the head bed flat, sir, can you turn on to your left side for me? Okay, I'm going to feel for the PMI, fifth intercostal, mid-axillary. Okay, and I'm going to listen. Okay, you can go ahead and lay onto your back. Okay, S1, S2 noted, no additional heart sounds heard. Okay, and while I have you uncovered here, sir, I'm going to just raise that up just a little bit. Okay, well, I have you here. I'm going to go ahead and percuss the lungs in the front. Okay, and then I'm going to listen to the lung sounds in the front. Can you take a deep breath when you feel my stethoscope? lungs are clear anterior and posterior in all lobes. Okay. Okay, so I'm gonna cover up the front here. I'm gonna kind of pull this up a little bit here to do the abdominal assessment. I'm gonna look at the abdomen, there's no pulsations, nothing else going on here. Want to listen in all 4 quadrants. Okay, active bowel sounds times 4. I'm gonna listen for the renal arteries. Okay, no bruise. Gonna percuss. I'm gonna percuss the liver. Okay, and the spleen. Okay, I'm gonna do light palpation. Can you just let me know if this hurts at all?
Okay.
Does it hurt?
No.
Okay, and now a little bit deeper. Okay? Okay, so that's a normal assessment. I'm gonna palpate your liver here. If you can take a deep breath for me, sir. Okay, thank you. And the spleen, if you can take a deep breath for me. Thank you. Thank you. Okay. And a feel for the femoral pulse. Listen for any breathing. Okay, no brewing. Okay, I'm gonna come down and do the pedal pulses. I'm gonna push your feet in a little bit, thank you. Okay, I'm gonna do them from the side so you can see. Okay. Okay, pedal pulses are strong and equal. Now the posterior tibial pulses. Also strong and equal. While I'm here, I'm going to go ahead and assess for cap refill. Okay, cap refill is good, less than 3 seconds. And check for edema. No edema. Okay, so we're going to go ahead and check for your range of motion while we're down here and your muscle strength. Can you take this knee and bend it up towards your chest? Okay, great. And can you pull it over and up? Okay, and then back down. And how about this one? Up toward the chest, and then up, over, and then out. Okay, full range of motion, and those extremities. Okay, come on over and sit up now. Okay, so let's go ahead and continue the range of motion on, let's get you off the ceiling a little bit. Okay, excellent. So can you go ahead and extend this leg out? Okay, and cross the body and over. Okay, excellent. And push it down. And then out, cross the body. Okay, and then over. Excellent. And then back down. Excellent. So you've got full range of motion. Now, I want you to go ahead, we're going to test your muscle strength. So when I press on you, I want you to go ahead and resist. Can you resist me? Okay, great. Can you push those good? Resist me, good. And resist me pushing? Okay, excellent. On your feet, can you tip your ankles, your feet up? Okay, and then down, and then your heels together, and then forward. Okay, excellent. Okay. Okay, so I want you to resist me pulling. Okay, excellent. Resist me pushing. Okay, resist me pulling. Excellent, and pushing. Okay, and the same thing on your ankle. I want you to resist me pushing and resist me pulling. Okay, resist me pushing and resist me pulling. Okay, excellent. While we're here, I want to go ahead and check your deep tendon reflexes. Okay, excellent, thank you. Can you take your shin and your heel and run it across the shin? Excellent, and this one over here? Excellent, okay. Could you close your eyes for me for just a second? I'm gonna move your toe, and I'd like you to tell me in what direction am I moving your toe?
Okay.
Okay?
Up, left, right, down, left,
Okay, and now on the other side?
up, down, right, left, up.
Okay, excellent. Okay. Just gonna, you can open your eyes for just a second. Okay. Excellent. Okay. I want you again to close your eyes. I'm going to check your sensory perception by either doing a sharp poke or a dull side of this clip. Okay?
Okay.
Okay, so go ahead and close your eyes. I'm going to do it on your arms and your legs.
Dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp,
Okay.
dull, sharp, dull, sharp, dull, sharp, dull, sharp,
On the other side now.
dull, 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 sharp, dull, dull, sharp.
Okay, excellent. You can go ahead and open your eyes now. Okay, so we did full range of motion and good muscle strength in the lower extremities. We completed our part of our neuro exam. While I'm down here, I should just one thing. Sir, I want to check a Babinski sign on you, so I want to rub this along the bottom of your foot. So it just tickles for just a second, okay? It does tickle, doesn't it?
Yep.
Okay, that's a negative Babinski. And that completes our neuro exam to the bottom of our feet. Okay. Excellent. So now we're going to go ahead and check your range of motion in the upper extremities. Can you go ahead and put your head, your ear to your, okay, and this side to the other side? Excellent. Can you look this way? Excellent. And this way? All right, awesome. Now I want to see if you can bring your arms out in front of you and then behind you. Okay, excellent. And then bring it back forward. Can you put one arm and try to touch your shoulder blade? Okay, excellent. And can you do the other arm? Okay, excellent. Okay. All right, and actually, that's good. Can you do like a football goal and bring your arms up like this? And then up like this? All right, excellent, good. Can you go ahead and take your hands down like this and do some, I want you to do rapid alternating movements like this? Okay, all right. Excellent. Now can you go like this? All right, and then down. Okay, range of motion is good. We're gonna do the same thing that we did on the lower, where I want you to resist me pulling or resist me pushing, okay? Okay, so go up like a strong muscle and resist me pulling. Okay, and resist me pushing. Excellent. Resist me pulling. Resist me pushing. Okay, excellent. Can you take your hands, make a fist, and release? Make a fist, release. Can you bring them up? Okay, and down? And the backs together, and fingers together? Okay, excellent. Now make a fist for me, please. And again, resist me pushing and pulling, okay? So you can bring them up a little bit. Okay, resist me pushing. Okay, and resist me pulling. There. Excellent, thank you very much. You can just relax your arms. Okay, so that's full muscle That's full range of motion and muscle strength in the upper extremities. Okay, we did all of that. Okay. I'll bring you down on the ground again. Okay. Now, sir, can you go ahead and stand up? And if you can face the camera that way. Okay. Okay, with your feet together. Okay, just stand there for just a second with your eyes open. Okay, and now close your eyes, please. Okay, excellent. You can open your eyes. That's a negative Romberg test. Okay, and can you take one step forward that way? Okay, excellent. Can you put your arms out like this in front of you with your eyes closed, please? Okay, excellent. You can go ahead and lower your arms. That's a negative pronator drift. Okay, and now, sir, I just would like to assess your gait. Can you walk over toward that chair right there, or just regular? All right, and then when you come back, I'd like you to walk heel, toe, like that. Okay, excellent. And go ahead and turn. And when you walk now, walk back again to that chair. I'd like you to walk on your heels. Okay, excellent. And can you now walk back on your tippy toes? Okay, excellent. Come on over, right over here. Sound good? Okay. Can you just just that way, just so I can be on camera? Okay, thank you so much, sir. Okay, now can you bend over, please, and touch your toes? Just going to assess your back. Okay, excellent. And then come on up. And can you stretch back? Good. Okay, excellent. Can you bend to the side? Okay, great. And to the other side, please. Good. And can you twist? Okay, so no problems with the back mobility. Okay. Okay, that will complete our physical exam. Thank you, Dr. Lofton.